Hello, I'll be talking about the 65-year-old patient case, and I think it's just important to note that this patient is about a year out from suffering a stroke, and he's been doing well with, being able to use the cane as well as having this brace. But it's definitely important to note that we want to progress with this patient's, overall well-being and promote strength as he plans on living for a while. So I think it's really important to address both strength as well as aerobic exercise, which is what I'm going to be talking about for the two fitness components I like to focus on. And it's also important to note that he enjoys walking his dog, golfing, such as swinging the golf club and playing with his grandkids. So why is it important that this patient does get prescribed with the proper exercise component? It's important because this is going to help maintain his strength, balance, and overall stability. That way, he's less likely to fall, as he has fallen 3 times within the past year. And the goal is to also help improve his coordination on his left side, from which he suffered from the stroke. So the first component is aerobic exercise, and that's just going to involve some brisk walking that I think he could easily do. He could do this about 3 to 5 days per week, and we can start at a moderate intensity and hopefully gradually progress both the time as well as how quick he's walking. And it's also important to note that he walks properly, such as upright posture, and he can use his cane if needed. And this will hopefully gradually build up his endurance, and then if he chooses to play golf, hopefully in the future, he can walk around the golf course without getting super tired. The second component is strength training, and this is both upper and lower, and he can do this just in his house. He doesn't need any gym equipment, so it's pretty simple and very feasible. And for the strength prescription that I would like to focus on, he could do this about 2 to 3 times per week. It doesn't have to be consecutively. This could involve some light resistance. It could be body weight or some small weights if he has any, or resistance band. It could be 10 to 15 reps in about 30 minutes total. Again, it doesn't take that long. It's in his house. It's not super difficult, and hopefully we can progress. And specifically, I was thinking of some exercises which could involve him getting up from his chair, such as sit to stand from the chair. He could do this about 10 reps, and this will hopefully develop his lower body strength, and he can have the cane next to him if need be. He could also do some wall push-ups, just him pushing from the wall and hopefully strengthening his chest muscles as well as his shoulders and triceps. And could do 10 to 12 reps for 2 to 3 sets. And lastly, I think it's also important to address his left side weakness from what he suffered from the stroke. And he could perhaps do some left hand grip practice, such as squeezing a ball for 5 seconds or a towel, and repeat this 10 to 15 times. And again, it's just important to note that hopefully he can gradually progress, and eventually he'll be able to do the things he once loved. And it's very important to make sure he maintains consistency when doing these exercises throughout the week rather than intensity. We're more focused on him following the certain protocol, and it'll hopefully show within the future that he'll be able to gradually progress. So